Morning, everyone. Apologies for the delay. I got into road traffic, very, very heavy road traffic. I'm analog, I'm used to driving. And this is even worse than the actual roads where I drive through. I'm used to going to halls to talk to people. And I got caught up now with this COVID thing. And I'm having to talk through things that are very strange to maneuver. So forgive me for being late. I'm learning on the job, so next time it will be a much easier time. So I really, really apologize. Anyway, let's go to today's topic, which is a very, very interesting topic. First of all, I would like to call myself by my names. I'm called Dr. Jane Wakahe, an obstetrician and gynecologist by practice, and also a holder of a degree in public health. As a gynecologist, I talked one-on-one and sort out issues reproductive health and issues baby delivery. And as a public health person, I go to the bigger picture and look at what the common mwananchi is going through, and hence a certain initiative called She Chooses to Live initiative that I run to do the same, to look to Wanjiku. So let's talk about bleeding in pregnancy. And before we even go to the bleeding of pregnancy, let's talk about bleeding in a woman. Every month, the uterus waits for a baby. And in its waiting, it makes a very nice purge in an area called the endometrium that is inside the uterus. Makes a very, very nice purge, hoping that the sperm that is deposited in the vagina will swim far enough into the fallopian tube and pick the egg and make it into a fertilized egg. And they come and implant into the uterus, into that sponge called the endometrium. Now, if that doesn't happen, if the egg dies for some reason, and by the way, the egg lives only 24 hours, so many of them die. If the egg dies for any reason, then the body is told that there is not going to be a pregnancy. And the uterus actually weeps. It gets so unhappy. It weeps so hard, it weeps blood. So you can imagine that when somebody is pregnant, the uterus is now very, very happy, and it must never, never weep. So weeping in pregnancy is very, very dangerous. Now let me say the first thing about this bleeding in pregnancy, that it is never, never a normal occurrence. It is always an emergency. You must always take it seriously. In fact, if you know that you're pregnant and you start to bleed, the first thing you do is start taking yourself towards a health facility and call your doctor or your health provider as you are going along towards the health facility, because it could be a very, very serious issue. So bleeding, and you will hear me say this time and time again, bleeding when you're pregnant is always dangerous. Today we are going to cover bleeding in pregnancy for the first trimester only, because the first 12 weeks of life of pregnancy, which are the first trimester, are a bit different from the second and the third trimesters. The causes of bleeding are different and the outcomes are different. So we shall do this topic in two sessions. One of them, which we are going to do today, is about bleeding in the first 12 weeks of pregnancy. Now, what would cause bleeding in the first 12 weeks of pregnancy? One could be pregnant but still bleed through the genital system without necessarily bleeding from the pregnancy. So when we are talking about bleeding, we start from outside at the vulva. And we could be having some lesions, some vulvar warts, some ulcers that are causing bleeding. But you see, you as a client who is pregnant, you do not know. So you want to take it seriously and consult your doctor. A bit inner, one woman could be bleeding from the vagina. That would be that there could be some infections, some tears of the vagina. But again, as a client, you don't know. So don't take it lightly and think it's just a little bleeding. Further up, it could be that it's the cervix that is bleeding. The cervix is usually very well loaded with blood when one is pregnant. In fact, the whole genital system, the uterus, the cervix, everything about the pregnancy takes about 25% of one's blood supply. So it's really, really loaded with blood. And the cervix can sometimes be bruised or bleed for whatever reason. So it's not always that bleeding in pregnancy is about pregnancy, but I repeat again, you do not know that it's not about pregnancy, so you want to take it very seriously. Now let's go to the bleeding when you're pregnant. The minute you confirm that you're actually pregnant, you should not bleed. And if bleeding happens, there could be several causes. One of the reasons is that the baby may be wanting to come out, which is called a miscarriage, or in medicine we call it an abortion. When the egg is fertilized, the baby goes and plants itself into the uterus. Now the uterus is like an inverted pot, African pot that is put upside down, and the baby goes and implants itself right on top of the uterus. Now, in the first 12 weeks of pregnancy, that implantation is not very, very solid. And sometimes just being very, very active or being riding on bumpy roads or even sitting for too long can start to separate the placenta from the baby. The placenta is the nerve root of the baby. It's what feeds the baby and gives baby oxygen. So if the placenta is separated from the mother, the baby, if it's separated bad enough, the baby will demise. And it is also consequently not good for the mother. So the other causes for miscarriage, other than placental separation, is that in about 5% to 10% of all pregnancies that happen to be aborted in the first 12 weeks of life, the genetic composition of that baby is so abnormal that the baby itself rejects the baby and has it aborted. So sometimes it may not be anything one did. It could be that it is a genetically very malformed baby. It may not be that you were very active or you went on a long journey. It may be that the baby was just so malformed, it needed to come out. So when the placenta starts to separate, in the first 12 weeks, it is so small that sometimes just a little separation could get into the nerve root of the baby and make the baby die inside the uterus. So if one sees bleeding, one needs to go and check with the doctor. Fortunately, these days it's possible to do an ultrasound with the technologies we have and see if the baby is actually alive or not. There are various steps of miscarriage that we talk about. We have what is called threatened abortion, and that is when the baby is still alive but it is threatening to come out. And for that, if one goes to hospital early enough, sometimes it is possible to give support to the mother and to the baby and to have that baby live. Then there is a second type of miscarriage that we call inevitable. That one is actually the word inevitable. Whatever we do, that baby is going to come out. Then there is something called incomplete, which is again the miscarriage has happened but it's not completely come out. And in those two areas, the inevitable and the incomplete, the mother needs help to be able to evacuate completely the uterus. Sometimes it's through surgical intervention, sometimes through medical intervention, but the uterus needs to be cleared of the material that would have been a pregnancy. The other type of abortion is called complete abortion, and that one there is not much one needs to do because the pregnancy has already taken itself. So those are the kind of reasons and the kind of miscarriages that happen. The other reason, other than miscarriage, that can cause somebody to bleed in pregnancy is what is called an ectopic pregnancy. Now, an ectopic pregnancy is a dangerous state. The egg is fertilized in a place we call the fallopian tube. And it takes about 2 weeks for the fertilized egg to go through the tube and go and plant itself on top of the mother's uterus. Now, sometimes babies take too long to land into the uterus and they are caught by time because they have to land at some point to be able to feed. So if 2 weeks elapse and the baby has not yet gotten into the uterus, it will land wherever it finds, and usually that is the fallopian tube. And that is what constitutes an ectopic pregnancy. Now, ectopic pregnancy is very, very dangerous in the sense that the tube is a very small area. The minute the baby starts to grow in the tube, it will so widen the tube and make it so thin that it will burst. And when a fallopian tube bursts, then there is bleeding. There's a little bleeding through the vagina, even before the tube bursts. When it's an ectopic pregnancy, sometimes it warns that there's going to be there's a bleeding that is abnormal. But the worst bleeding when one is with an ectopic pregnancy is when the rupture happens, the bursting of the tube happens, and bleeding really happens in the abdomen. The abdomen is a very, very big area. One can bleed all their blood into the abdomen without realizing because there is none that is going out. And when that happens, a woman will go into shock sometimes and even sometimes to death. So if you suspect you're pregnant and you have a funny bleeding, as one is being done ultrasound to check for whether the baby is alive or not, then one of the things that is picked is ectopic pregnancy. It's always good if you are pregnant, if you feel a bit of pain that is persistent on either side of the lower abdomen, whether left or right, it's always good to check with your doctor that the pregnancy has actually landed into the uterus and not in the tube, because the tubal pregnancies can be quite a bit painful. And sometimes we are able to pick them before they have actually ruptured, in which case we can even really save that tube. But if it ruptures, then the usual answer is that tube will have to be surgically removed and the tube is no longer useful for pregnancy. So ectopic pregnancy, again, is another very dire state of affairs. Another thing that would cause bleeding in the first trimester, in the first 12 weeks of pregnancy, is something we call a molar pregnancy. Now, a molar pregnancy is a funny pregnancy that is not really formed, doesn't form a baby. It forms something that is called a mole, and the mole is full of many cysts, full of blood and full of water. And when that happens, then a woman can really bleed very badly, and especially because the mole does not even stay like the baby with a proper placenta. It digs into the mother's wall of the uterus, and when it starts to come out, it is almost impossible to totally come out because it's holding right into the mother's uterus wall. So it's a dangerous state. Now, to start imagining that one has a mole, the state of pregnancy becomes very, very pronounced. For example, the nausea is very, very high when one is pregnant, and with a mole, and the vomiting and the irritability, all of those. But this could be also a good thing. It could be that it's a twin pregnancy. So for people who have been pregnant before, if you feel more pregnant than usual, check whether it's a twin pregnancy or whether it's a molar pregnancy. But a molar pregnancy is another one that is a very, very dangerous kind of affairs. Now, a good one that causes bleeding is what is called implantation bleeding. When fertilization happens, about 2 weeks later, and that is about when the baby, the woman was expecting to get her next period, That is the same time as the baby is implanting into the uterus. In fact, a lot of women feel the cramps of periods coming. It's only that the period never comes. Or if it comes in a very little way. So a lot of women will experience cramps at the time they were expecting their next period. Some, the period will not come, but in about 15% of women, there will be a bit of bleeding. The good thing about this bleeding is usually not very heavy. It's a bit lighter. But a lot of women confuse this implantation bleeding with the period that they were going to have. So they are usually thinking that they're 4 weeks younger in pregnancy than they really are. Now, this doesn't always happen. It happens if the baby is implanting and happens to burst a blood vessel in the mother's uterine wall. That's when the bleeding happens. So this is a good kind of implantation. It doesn't get any further. It stops itself. But again, you need the doctor to tell you that indeed this was just implantation bleeding. So if we can recap, there are very, very serious things about bleeding in the first trimester of pregnancy. And we should always, if you take nothing home but this, is that when you bleed when you're pregnant, seek medical help. Do not start ringing from home. Go to the health facility and seek help from there. It is only the medical person who can tell you that this is not serious bleeding or that this is serious bleeding, to try to save the life of the baby you are carrying and to save your own life. Seek medical help in bleeding in pregnancy. That's about all I'll talk about today. As I said, I went through a lot of traffic. So now I'll take any questions that there are for the next few minutes. There's a question here that asks what tests have to be done for ovarian cysts to know if you're going to give birth or not for the rest of your life, because I've gone to doctors, specialists in vain over 5 years now. That question sounds like what is called polycystic ovarian syndrome, which means that a woman makes many cysts in the ovary instead of making one. Now, let me say what a cyst is. A cyst is a small balloon full of water in the ovary. And in that balloon full of water, the egg floats. And when that egg, the balloon is big enough, it bursts and lets out the egg. Now, in somebody with many cysts, then what that means is that they are making many cysts, many eggs at the same time, which are not being able to mature and they are not being able to be released. So then they are seen as little balloons full of water in the ovary, and that is a state of what we call subfertility. And if that is the case, then we shall in a future date discuss that topic called polycystic ovarian syndrome and what we can do about it. Does anybody have any question on pregnancy? Any issues that were not clear on bleeding in pregnancy? Like I said, I repeat again, it is never a simple thing to bleed when you're pregnant. Always, always seek medical help. Anybody with anything about pregnancy? Like I said, bleeding in the period is a weeping of a disappointed uterus. It gets very, very disappointed. and it is waiting for a baby, and when the baby lands, it says hallelujah. So again, I repeat, one must not bleed when they are pregnant, because that is a dangerous situation. Any questions, or we end the session? So if there are no questions for the time being, as you think questions, let me tell you about She Chooses to Live. It's an initiative that is ongoing. It is meant to help women in matters reproductive health, and it is an initiative that anybody is welcome to log into and find out what we do. We will hopefully, when COVID disappears, start going to the Wajiko of funny places, and the Wajiko in the areas that are not very well developed in our country, and start doing things like pap smears to screen them for cervical cancer, and doing other things, reproductive health. So this is an initiative that people should look out for, and soon we shall, as soon as COVID allows us, we shall be able to go and do pap smears. There is a question here that asks whether sex in pregnancy can cause bleeding, and the answer is yes. The cervix is very loaded with blood when one is pregnant. It gets an unfair, or rather a fair share of blood, so that it is able to sustain the pregnancy. And just a little bit of bruising when having sex can cause quite a bit of bleeding. When we talk next time about second trimester bleeding and third trimester bleeding, we shall talk about something called placenta previa, which means a low-lying placenta. But in the first trimester, the cause of bleeding is usually from the cervix, is that it is been bruised, it has been hurt during sex, and yes, that can cause quite a bit of bleeding. It is self-limiting though. But again, whether it comes after sex or not, then you should consult your doctor and make sure that it's just the cervix which is actually bruised. Sex is, there's another question asking whether then there is no sex in pregnancy, and sex is allowed in pregnancy. But there are few people I tell when they come with a bit of bleeding in pregnancy, I tell the men to actually jog, and jog morning and evening, and that doesn't augur well. Many times they come back into the clinic for the next visit and ask whether they are still jogging, and sometimes they still have to jog, especially when it is that the placenta is low-lying. But yes, sex is allowed unless one is in pain, unless one is got any bleeding. In fact, any bleeding when having sex, you must stop having sex until we establish that the reason is not the sex that is making it worse. And yes, some people will not have sex for many, many, many months when their partner is pregnant. I think that then, if there are no other questions, we will add the talk there, and we shall schedule another one for discussing bleeding in pregnancy in the 2nd and the 3rd trimester. Thank you all, and keep safe.